Bismillah ar-Rahman ar-Rahim. Assalamu alaikum jami'an. Good evening, everybody. Today we have first mock revision for communication. It will be communication with person or with relative. First station, it will be counseling for OGD or consent for OGD. Okay, you can start now.
طيب
يلا tell them
we
the
have
skill.
yes, we have a 60-year-old male patient, has a history of smoking, alcohol. The patient presents with dysphagia. Your consultant has gone off for a meeting and you are asked to consent the patient for OGD and possible biopsy and dilatation under general anesthesia. Okay?
Okay.
You can start now.
What's the name of the patient, please?
The patient is called Mr. Green.
Mr. Green?
Green.
Okay. Hello, Mr. Green. I'm one of the surgical doctors. I am Haifa, one of the surgical doctors. I have been asked to talk to you about an investigation that you would like to arrange for you. But can I first ask you, has anyone spoken to you about this procedure?
No, Doctor. Some just they told me they are doing some procedures and taking some things in front of my abdomen, but I don't know what's that.
Okay, so please let me explain it to you. This is what we call esophageal gastroduodenoscopy. We abbreviate it as OGD. So there is a camera that we call the endoscope. It will be introduced through your mouth, down your food pipe, and then to your stomach, along to your small bowel. This camera actually will relay some images on a TV screen, so we could have a look inside. Also, through this procedure, we can do some dilatation and take a tissue sample from the area that showed nervine from the barium study that we did before. This will typically be under anesthesia and sedation, so you will be drowsy and you will not feel any pain.
Okay, so there will be any risk for me when you are inserting this camera in from my mouth?
Actually, there is no procedure without complications. The possible risks for this particular complication include, for this particular procedure include, a damage to your teeth from introduction of the scope could happen. Also, an infection such as a chest infection. Also, a bleeding from the site where we will take a tissue sample. The most dangerous risk factor that you have is that we could cut through your food pipe wall. This is going to be a surgical emergency and will need a surgical correction.
Okay, so you means maybe you cut to my chest.
Yes, this could happen. It's one of the risks of the procedure.
So
But
you
I'd
mean
like to
do
tell
I
you.
have things to be happen or maybe?
Yes, these are risks for this particular procedure, but however, listing those risks doesn't essentially mean that they will certainly happen. So, what do you think about it?
Why you are going to dilate my food pipe? Why?
This is actually crucial for the determination of your condition. Also, I want to emphasize that only skilled and good experienced hands are going to perform upon you.
So do you mean, do I have some risky cancer, tumor or something like that? You are going to take sample.
It's actually still early to confirm this. We will have to wait until the results of this procedure come out and do some further investigations for that.
So there is no other facilities or investigation to do instead of this inserting this camera through my mouth and making some injuries. There is no other investigations you can do it.
Mr. Green, actually, as I said before, listing those risks and telling you about the risk doesn't essentially mean that they will happen. So my advice is to accept doing this, as it is crucial for your management, and it will help us determine your condition
Oh,
exactly.
no, I'm asking, there is no other investigation to do instead of this.
Not really. This is a step of the investigation, one step of the investigations that we are going to do for you. So we have to go through this.
Okay, how many time does it take, this procedure?
It will take typically a couple of minutes, maybe 20 to 40 minutes.
Okay, so while you are taking a sample, how many time does it take to result to come?
Usually it appears within 2 weeks' time. I can understand your apprehension, and I will contact you as soon as it is available.
Okay, so after this procedure, I can go home?
Yes, actually, typically it's a day case procedure. We just need to make sure that you have someone with you to drive you home and take care after you for the first 24 hours, as you are going to be a bit drowsy. Other than that, you will be discharged as soon as you regain your consciousness.
Okay, thank you.
Okay, so Mr. Green, if you don't have any further questions, let me sum up what we have been through.
Yeah, go through.
Okay, for an explanation of the procedure, it's an esophagogastroduodenoscopy. We abbreviate it in the form of OGD. An endoscope or camera is going to be introduced through your mouth along your food pipe and stomach and small bowel. We are going to relay some images on a TV screen. We will do some dilatation and maybe take some samples from the area of narrowing showed earlier in the barium study. There are some risks for this procedure as any other procedure. However, there is no risk without procedure, and it is crucial for the determination of your case. You've asked about the time of the results. It takes usually 2 weeks to appear, and we will make sure to contact you as soon as they are available. You are not going to be admitted overnight after the procedure. You just need to make sure that you have someone with you to drive you home, as you are going to be a bit drowsy. If you don't have any further questions.
No, thank you.
Okay, thank you so much.
Okay, thank you, Haifa. Thank you, Ziad. دكتور صلاح، أنا start ولا أنت هتستارت؟
لا ده انت
طيب. Overall, I think يعني you did very well. خلاص. البوزيتيف انت عندك structure. You started by asking the patient what he knows about the procedure. Then you try to explain the procedure to him. وده very good. خلاص. You were honest. You told the patient the risks. خلاص. You didn't lie to the patient. و يعني كنت بتanswer mostly patient questions. طيب what needs to be improved سريعا كده. انا بس عايز لما when you are explaining something long and complicated يعني تعالي في النص and ask, you can ask do I make myself clear, is it okay so far. في نص explanation in the middle you can check again for understanding. Okay. The second point, answer the patient question. يعني focus what the patient is asking. يعني twice the patient asked you a question and you responded differently. يعني هو قال لك there is another investigation. You answered there is no risks, it's unnecessary. and the patient repeated the question again. Okay.
Yes.
and he asked you about dilatation. Why do I need to do dilatation? And you answered about the perforation. So it's very important. يعني اللي احنا بنanswer ده, just most of the questions على فكرة are the same at the exam, but pay attention to what the patient is saying.
Okay.
Okay, this is very important. But overall يعني other thing, لو هو asked about specific risk زي البرفوريشن, يعني هو الريسك بيبقى 1 in 1000. Tell him the risk يعني in numbers, it's 1 in 1000 عشان understand. يعني انت كده objective. ده 1 in 1000 can perforate. Okay. But overall you did very, very well. And good
Please
luck.
don't attend percentage if you are sure from this percentage.
انا sure.
انا بقولها
يعني
هي
يعني لو حاجه, اصل دول بالذات في يعني في الكولونوسكوبي والبرسنتج معروف عشان كده يتقال. اوكي دكتور صلاح.
Okay, Dr. You told me that one of the risks can be happened is cutting through. Okay, how I know if when you are introducing this instrument through my mouse, how I know that I have this cutting through?
I don't know the answer for this.
ازاي تعرف ان في perforation المريض كلينيكالي؟ شفت ازاي بقى؟
هيفاء you know for sure.
هي بس طريقه السؤال مختلفه.
يعني البيشنت asking you how I know ان انا حصل لي perforation.
What is the warning signs when I will go home to know that I have cut through in my?
Okay, when you feel your condition is deteriorating, if you have increasing pain or shortness of breath,
Yes.
or you feel a bit drowsy.
Yes, chest pain.
Yes.
طيب انا بس سؤال حاجه تانية, هو العيان سالك there is another alternatives to the procedure. I know in this you said ان هو عامل barium swallow. لو ما كانش مكتوب كده you must tell him yes there is another procedure called we use a contrast. Okay, a contrast study, but the problem we can take a sample from your food bio. Okay, فانت لازم نركز بالظبط مكتوب ايه في what is written exactly in the stem. Okay.
Okay.
One of the tricky and the tips things will be happened in coming exam and very, very important. It's very, very important. وبحذركم اهوت عشان اطلع من الامتحان يقول لي يا دكتور صح الاستم اتغير او كده انت السبب.
هيغيروا الاستم على فكره.
بالظبط كمان بتكلم في الحته دي. In these stations communication you will go for the feedback coming for any person failed in exam in OSCE, you will find communication skills, especially this station or this type of station communication with person. Why? They now started to change some things from the file, like patient barium swallow contrast done, and in other centers not done. So examiner can ask you, or actor can ask you, doctor, did they investigate me before or not? طبعا you will tell yes, we did barium and we find and they didn't mention anything about it in the file. You miss this station. You will get big zero. What you are doing, whatever you are doing. كلمة واحدة. I did great, Dr. Salah, but really I don't know patient did barium swallow or not. And wrote written in the file, and when actor told you that did they investigated me before, doctor, they did the investigation in my file, what you will tell? Yes, we did barium and not written. بكارثة. So from now, if you will not read the file carefully, you will miss this station. معك فايل اقراه وقول اللي فيه.
if you don't know, it's much better ان انت تقول I don't know, I will check and come back to you.
Yes, if you can't read the file.
Much better يعني.
Okay, I don't know really. I will check your file. I will confirm by checking the file and will be back to you. Only that. بس مش كل حاجه تقول له I will check معاك انت ما شيكتش حاجه خالص.
مره يعني في الستيشن.
مش كل حاجه تقول طيب. We have another question. He will tell you, I think in this station, I don't know this station or other station, but I think in this one, no. Yeah, not in this station, the other question. Okay. I think the only question about what is the warning sign if I will go home that I have cutting through in my foot bite. What is that? Great, high five. Great, excellent.
Thank you.
Next.
Next we have Mustafa Usara. طيب. Mustafa Usara, raise your hands, please.
100% they will change some things from the file. 100% this will be happening.
فين مصطفى أسارة؟
Raise your hands.
يعني الله انتم مهذبيننا في كل حاجة صراحة.
مصطفى هوت يلا.
اوكي اهو مصطفى. ماشي.
السلام عليكم.
وعليكم السلام ورحمة الله. سارة raise your hand please. اوكي طيب مصطفى ومفيش سارة، هناخد حد من السبير. هناخد ياسمين، اي حد. رامي ماشي اوكي. رامي. رامي انت معانا؟
ايوه يا دكتور مراد.
اهلا رامي. how are you?
Hello, how are you? I'm fine. ازيك يا دكتور صلاح؟
دكتور صلاح شكله مش سامع. طيب اوكي. طيب احنا عندنا مصطفى هيبقى الدكتور ورامي البيشنت او الريلاتيف. خلاص احنا هناخد الستيشن بتاعت الانشس بيرنت for perforated appendix. Okay, are you ready? Okay, so hello.
Yes.
اوكي انتوا سامعيني كويس؟ طيب you are the SHO on call for emergency general surgical admissions. A 10-year-old girl has just been admitted as an emergency case with signs of peritonitis. She has been unwell for 2 days. The child is extremely ill. A perforated appendix is suspected and she's being resuscitated by your registrar before being taken to the operating theater. Your consultant, Mr. Mann, is on his way from home and will perform the operation. You have been instructed to see the child further and explain the situation. Okay? You did not have an opportunity to see the child yourself before she was taken to theater. Is the stem clear?
Clear, yeah. What is the name of the child?
The child is called Sarah.
And Dr. Rami will be the father?
Yes,
Okay.
he will be the father.
Anxious mother or father? The anxious mother.
بس انا said father وكنت عايز اشوف هو خد باله من الستم ولا لا. يعني
هو اتكلم للاسف.
I intended ان هو يقول كده. يعني انا كنت قاصد اقول father.
الحمد لله.
طيب اوكي. You can start. خلاص.
father ولا mother طيب كده؟
خليها mother طالما خدت بالك خلاص.
She has many problems with her husband.
Yes. Okay, go on.
Hello.
ثواني بعد اذنك بس ثواني. هو بعد اذنك يا رامي، هو من قله الفيميل اللي معانا مش عارفين نلاقي انشس ماذر. ما انتوا انشس ريدي، يعني انتوا كده اساسا انشس طول الوقت، مش عارفين يعني حد تمثل له الموضوع ده. ماشي نبدا.
هتودينا في داهيه مع الفيمينيزم.
ليه يعني ليه؟ ما كل مره بنشتغل بالطريقه دي. يلا.
Hello.
Yes, hello.
Hello. Yeah.
Hello.
Mrs. Joan mother?
Yes.
Okay, I am Mustafa Mishnib, the SHO working for Mr. Mann. Mr. Mann is the consultant of general surgery in our hospital. So I am here to speak to you about John's condition. Is that okay with you?
Yes, please.
Okay. First of all, I'd like to ask you, what do you want me to call you?
Call me anything.
Okay, miss. Okay, sorry for that, yeah. But first, I'm here today to discuss, as I told you, about John's condition. So can you tell me how do you know, or what do you know so far about her condition, first of all?
I am a single mother. I have been working for extra weekend shifts in a local biscuit factory to make some money and to take my daughter on holiday. This would be her first holiday since 2 years. Her father had been died in a hospital after a major cancer surgery. I left
Oh,
her.
yeah.
I left my daughter with my neighbor, and I have been told that she had tummy pain since 2 days, and I feel very sorry and I feel guilty to what happened.
Oh, sorry to hear that. But first of all, I can see you are frustrated. You don't have to be guilty. What happened can be happen anyway. So you have not to be feeling like this. Yeah, Mrs. Your frustration. Yes, but first of all, I'd like to explain. Thank you for your information and sharing with me this information. I will explain to you now about her condition. Is that okay with you? Hello?
Yes.
Okay. So your daughter today has been brought to the emergency by your neighbor. At that moment, she was very ill and she complaining of tummy pain and with high temperature. And then we made to her some scan opposite to her tummy. Unfortunately, we found that she had inflammation in an organ inside her tummy. It's called the appendix. And I unfortunately also I'm telling to you that she may have burst for this organ. So this organ, sorry for this medical term, appendix, one of our organs that related to the large bowel, where is the bowel is formed. Okay, can you follow me?
Yes, I am with you,
Okay,
doctor.
it's clear, yeah. Okay, thank you. So it is one of our organs that present in the tummy, where is the bowel is formed, and we suspected now that she had inflammation in this organ and some infection also inside her abdomen. And this situation is medical emergency. That's why we can't wait until you came and see her before she going to the theater now. I'm sorry to that, miss. But do you have any concerns about that?
Oh my God. Acute appendicitis. Doctor, please,
Yes.
can you tell me your position here in the hospital? And are you sure from this diagnosis?
Yes, I can see you are upset and frustrated for sure. I can understand your apprehension. I am, as I told you, I am SHO working for Mr. Ma'an. Mr. Ma'an is a consultant. He will do the operation for your daughter. Okay, and we did for her a scan in the tummy, and this tell us what I discussed about the infection and inflammation in this organ. Okay, is that clear for you?
Yes, doctor. But
Yeah.
I want to know what is dangerous in my child's situation. I see that is appendicitis can be managed easily. What is the dangerous here?
The problem here, as your daughter is still a child and in the same age, we probably the patient has low fat inside the tummy. Okay, so that increasing the risk of getting burst of this organ or rupture and increasing or spreading infection all over his tummy. Is that clear? That's why it is mostly dangerous for this age group. Yeah.
Oh my God. I'm very, really scared from this. Will it leave a big scar, doctor?
I can also again I can see you are upset for sure, but let me explain to you. Yes, in this situation we probably do or will do cut through her tummy. It will be small, but in some situation we to visualize more better in her tummy we will need to extend this cut, and most probably if we extended this cut it will leave disfiguring scar. I'm sorry to tell you that, but we will try to make it a nice closure. Yeah, is that okay and clear for
Okay.
you?
Okay, I can see. Doctor,
Okay,
please, will my child be infertile in the future as a complication from this condition or as a side effect from the operation which you will do for her?
well, for as we discussed in this situation we have a severe infection inside her tummy due to the burst or rupture of this appendix. And in this case of severe infection, we may got an blockage of her reproductive system. So this is the system that responsible for her fertility in the future. Can you follow me, Miss?
Yes, I am with you.
Okay. And this may give her subfertility in the future, but until now we are not sure. But make sure that we will put it in our concern to test and investigate this in the future for sure. Yeah.
Will you do this investigation for her?
In the future, I told you, we can
Yes.
go and investigate this. Yeah.
You will do this investigation?
In the future, maybe.
Okay, thank you, Doctor, very much.
Okay. Do you have any other questions, other concerns? I didn't cover it until now.
No, thank you, Doctor.
Okay, so can I summarize to you what we discussed in our discussion today?
No, Doctor, thank you. I had got the idea.
Thanks, thank you for your time, thank you.
Thank you.
Okay, Dr. Mustafa, can you please tell me again what is the name of the consultant?
Mr. Mann,
Oh, no, not again. I don't want him to touch my daughter or my son.
well,
He did the operation to my husband. He killed him.
Oh,
My
sorry.
husband has a cancer and he did the operation to him and my husband died.
Sorry to that. It
I-
should be a very difficult situation for you. I can see.
I need to change the consultant.
I can see, but I can see you are afraid, yeah, and upset for sure. I can see and I can understand the situation for you. Something difficult, yeah, for sure. But let me explain to you, Mr. Mann, he is in the consultant in duty today, and what happened before may be something unusual, but he is one of the good and experienced surgeon, and he was the one in duty today in our ward, and he will take care of your daughter, make sure that he will take care and try to fix her problem, make sure. Is that okay?
Okay, so I have the right to change him or not?
You still have the right, but as I told you, this will your child today, in case it is a medical emergency, and we have to intervene as much as we possible as we can to prevent her or protect her from any complication.
But I told you he did the cancer operation to my husband and he killed him. What is the difference? He is going to kill my son.
Well, I can see your frustration for sure, yeah. But you know, this operation, most of the appendicitis operation, one of the operation was best result here in UK. And Mr. Mann, as I told you, he one of the good surgeons our hospital here, and I think and he will manage this your daughter condition very well.
Okay, doctor. Okay. Thank you.
Thank you.
Your target of discussion in this question, your explanation or justification for this question. Number one, you should tell that he's in duty. I agree for that. Number two, that these two operations are different.
عشان كده أنا قلت له إنها cancer. I said it's cancer.
So risks will be different. Okay. Number 3, and very important, any delay to change the consultant, this will worsen the case of your child.
Okay.
طيب دكتور مصطفى I think يعني you did well. يعني أنا بقول comments بس مش معناه إن you did well, you introduced yourself, checked the patient understanding, you showed empathy, a lot of empathy, you explained everything to the patient. يعني overall very well. بس في شوية ملاحظات كده ان انت يعني استخدمت ساعات كلمات زي the appendix will burst. ايه burst دي؟ مرعبة قوي يعني خلاص. cut through it will
rupture.
لا بلاش rupture برضه
بلاش rupture.
يعني
اوكي.
طيب انت don't sell yourself. يعني انت explain بس the patient برضه can understand. يعني انت قلت لها large bowel, the part that forms your boo. ما هو انت بتكلم layman language but she is not retarded. يعني she knows what's large bowel.
Okay.
Okay. scan. I didn't mention في اي حته ان في scan. Okay. انت عايز to explain بس don't sell yourself. Test, you said there will be block in the tubes and we will do a test in the future. يعني don't say information ملهاش لازمه. ما خلاص ملهاش لازمه. هو هيبقى فيه, ممكن يبقى فيه في الفيوتشر maybe, وخلاص يحلها الحلال بقى. Okay. But overall you did very well.
Thanks.
You welcome.
الكوميونيكيشن بتاعتك زي الكوميونيكيشن بتاعتي كالعاده اول ما كنت بادئ. We can't act. Our acting is very bad. Not like our ladies here. They are good actors. Okay.
هتودينا في داهيه.
والله لا يا عم عادي, هم عارفين هم عارفين لك يا عم. هو صراحه طالما بيتكلم يبقى ما بيعملش, بيقول بس كده. طيب. So the tone very important. Tone of your voice not accepted. يعني you should raise your tone, you should decrease your tone of your voice. This is very important. Okay. I didn't see all of you when doing this practice. Eye to eye contact, body language is very, very important. You will get marks for that. So look for her and try to show the examiner that you are listening for her, you are caring for her problem, you are good responding for her concerns like this way. اللي هيبان how you are good actor by changing the tone of your voice.
Yes.
changing the tone of your voice. مش واحد لا بلاش. اوكي.
ولازم التون اوف يور فويس برضو تو ريفلكت الكونفيدنس. يعني ان انت برضو confident دكتور. يعني انت مش hesitated, مش ما عندكش confidence. يعني انت in the beginning you asked her about the information and when she answered you told her sorry for asking. لا, it's your right to ask, so don't apologize for this. Okay. Okay. Thank you دكتور مصطفى.
Thank you.
لو ما عندكش سبير في الناس, you will take TKR will not do it. They will read it only. يعني will not do practice for TKR by the way. I'm not doing practice for TKR. يعني اخر لجنه دي مش بعملها. فالناس اللي موجوده في الTKR ممكن تحطهم في لجنه ثانيه لو ما فيش حد. تمام.
طيب ما انا بدات فعلا يعني ايه, هو انا مش لاقي حد اصلا. طيب انا عندي دلوقتي احمد, وهبه and سعيد. raise your hands please.
احمد وهبه رفع ايده اهوت.
جميل. عقبال سعيد.
Hello, Dr. Murad. Hello, Dr.
Hello,
Salah.
Dr. Ahmed.
How are you? Great, thank you.
Okay. Okay, we will take someone from the spare list. Anyone? Yasmin, Abdulrahman, Nurhan, Men'im, Nidal. Raise your hands, please.
What is the case? What is this station?
Okay, so يعني هم مستنيين الستيشن. Okay.
الانشس برضه, الانشس بتاعت السبلينكتومي.
خلاص. اوكي. دكتور صلاح تشوز.
want anxious female. We want anxious female.
آية.
Hello, Dr. Murad. Hello, Dr. Salah.
Hello, Aya. Are you anxious enough?
Yes, and I had this station in my exam. That's why I raised my hand.
Okay, great. Okay. So حد عايز يقول حاجة? Anyone wants to say anything?
ابدأ على طول.
Okay. Okay, we have a child with splenic rupture. Her father consented for the operation, and the mother appears suddenly after the child being taken to the operation. She was crying and she wanted to speak to the consultant who is doing the surgery. Okay, you are the surgical SHO covering for the consultant, and you ask it to speak to the mother who is waiting for you in the room.
Okay.
Okay, but she's
And
not crying, she's angry. Okay.
and the mother name?
The mother name is called Miss Brown.
Again, please.
Miss Brown.
Miss Brown. Okay. شكرا دكتور مراد. Okay. أبدأ.
Okay, go on.
Okay. Hello, I'm Dr. Wahba, one of the surgical training doctor
Hey,
here.
finally I found someone here. Are you a doctor?
Yes, I'm Dr. Wahba, one of the
Okay,
surgical doctor
please
here.
answer me. What's happened to my child?
Okay. Firstly, I apologize for you that you are being waiting here and no one contact you
Oh,
before.
okay. I've been waiting for so long time. So please tell me what happened to my child.
I know it must be difficult for you. You hear this news, but firstly, I'd like to know what you know about your about his condition so far.
I don't know. I had these calls telling me that my husband here in the hospital with his father and don't know what's happening.
I see. Okay. So Mrs. Brown, your child will fell off the climbing frame and he harmed himself.
Oh my God.
For sure.
Oh
And
no.
I apologize. Yes.
No. That can be happen.
Yes, for sure. I'm so sorry and apologize again that you couldn't see him before.
Please let me
taking
see.
him.
Let me see my son now. Please let me see him.
I am sorry again. Your son going to the theater now as he is an emergency case.
The
and
theater
Yes,
emergency.
yes. Unfortunately
Oh
for that.
no. Oh no.
You can have a seat, please.
So
Just a
you will
second.
explain to me.
Yes, for sure. Unfortunately,
Okay.
we have doing some investigation for your son, and it came and suggested that he having some rupture of an organ inside his tummy. It's called spleen, and he's now going to the theater to fix that. Are you okay with me now?
For sure, I'm not okay. You're telling me that my son in a dangerous situation is taken to the theater and his drunken father consent for him?
I see it must be difficult for you to hear that, but I like to explain more about that. It's okay to explain more about his condition
Yes,
first?
please go ahead.
Okay. As I said before, he has ruptured spleen, and it's some organ inside his tummy.
For sure, I know what that mean by this organ, so please go on.
Okay, so we are going now to the theater to fix that, and you have to know that it's he's in very good hand, experienced consultant that will operate on him, and will give you feedback about how serious his condition.
So what should I do? What you want from me? You already let his drunken father consent for him. So what should I do now?
Okay. First of all, I have been told that his father, that is his child, was playing at the garden. Suddenly, call out that he has a pain here in his left upper tummy from after falling from the height. So he come, and after examination, we have a big bruising on his left side of his chest. Then he called the ambulance. Now we are sharing another information about his father. Is that right?
I don't know. I'm just hearing this from you for the first time.
Okay, that's what happened for that, and his father confirmed that.
Yes, and he already let his drunken father consent for him. So what is my role now?
That,
what should I do?
Okay, firstly, we didn't have this situation about your home, and I have now to share this information. In some cases of this, like yours, we have to take extra precautions to ensure that your child is going to be safe, like taking some standard procedure, like finding out about the child situation at home, maybe calling the child protection consultant, which is routinely done for involving the protection service for this case. Are
Okay,
you?
well, now you want my consent now for him?
No, this is emergency, and we have to go to the theater, and he's already his father is being consent for that. We have now to wait until we have what the condition and what is the future problem that we'll have. Okay.
Okay, doctor.
So now I'd like you to tell more about the operation and what happened to him. As you said before, that you know this.
I know enough. I know enough. You've explained me enough.
I apologize for that, but I have to, to tell you about all of this as a routine. So I'd like you to listen to me carefully.
I don't care for this routine. I don't want to know more. I got everything and I understand. It's okay.
Okay, so could you tell me what you know so far about that?
Yes, I've heard that about the operation, my child situation, and all of this. Yes, and this structure's plan, you're gonna to fix it. It's okay. I know now.
Okay. Do you have any other, questions about his condition, about what will happen after this operation?
No, thank you. I don't have any other question.
Okay. So could you just get you any help?
No, thank you. I don't need any help.
Okay, so again, if you need to ask me about anything, please let the nurse contact me, and they will call me to come to you and to inform you about the information about the condition of your son. Okay.
Yeah, okay, thank you.
Okay, Mrs. Brown.
Okay, very well. Great actor. Changed the scenario عن اللي written ودي حاجة perfect لأن هي she had the situation. Yes, perfect. You did it perfectly. عشان ده مثال إن we have to react to the situation. يعني he started great. You did very well in the beginning, but you got surprised when she kept asking his drunken father. She said it 4 times.
Yes.
You
And
have to respond from the first time. That is her main concern in this case. يعني you told her about the situation, but now this is the main concern. You have to address the main concern. And at the end, you had many information in your mind and you need to just regurgitate the information. She told you, I don't need to know about this. I understand all. She needs maybe more confirmation on her what concern. Again, I reassure you that we will do the best, what's best in your child. And again, I confirm that we will contact the child protection services because this is her main concern. I know there are other questions, but she's not interested. Okay, so you have to be malleable. يعني respond to the questions. And sometimes even in the phone call, the examiner may ask you different questions. Okay, so be malleable. This is one. The other thing, your voice tone, again, monotonous. Empathy, you have to act. يعني انت, you don't know, they act actually. When you say something to an in England or in Sweden, they, oh, I'm very sorry to hear about that. What happened? Like this. I'm sorry to hear about that. No, act that you are empathetic. You are, we say, mirroring the patient. Okay, not mirroring her anger, but she's worried or concerned. So you appear also that you understand her words. You are concerned also about her words, not this monotonous voice. But you did well, but just take care of these points.
Okay.
Okay, Dr. Hiba, she asked, what should we answer here as regarding taking consent from drunken husband? I open the mic for you. You asked the question, I want you to answer it. جاوبيني يلا دكتورة هبة. يلا جاوبيني هتقولي ايه؟ مش هجاوبك هنا. انت في موقف امتحان دلوقتي. Listen, this exam is not knowledge. Not knowledge. Okay? So how to deal with this question?
Okay, I'm going to tell her that we are doing what it's for your child's best interest, and after evaluation of the child.
I'm asking about the question.
Yeah.
She's asking, do you consent? Do you consent the drunken husband?
As you were not available at that time, and the only one to take the consent from it was your husband. We took the consent from him, and we don't have the information about his social behaviors, and at the end, we are not doing any operation for your child unless we know that it's a must to do it for saving his life.
Okay, for saving life, you can consent to drunken father again. يعني okay, يعني this is her consent. دكتورة آية, what do you think?
أيوه.
What do you think?
هو المفروض أنا في الوقت ده هشرح لها عن type of consent. This emergency
Excellent.
situation, so I can proceed without consent even for the best interest of the child.
Okay.
Right. Plus, you should explain for her why you consent further. Why you consent further?
Yeah.
Like about it, I give him the information. يعني for consent to agree for the consent, we give him information. He can analyze. He can repeat what we told for him. So he's competent. Regardless his level of consciousness, what you are talking about. Okay. This first point. Second point. If we know 100% that he's drunken, for sure we will take your child for OR as this life-saving without any consent.
Yeah.
يعني ما don't accept على طول ان هو drunk يعني.
اشرحي ليه؟
يعني هو كان اكيد فايق يعني.
اشرح انه كان فايق بالظبط كده، واضح انه كان فايق. We give him the information about the operation, the indication for operation, contraindication, and he agreed for that, and he repeated for us what we did, what we explained for him. كده بالظبط يعني.
هي الفكرة ان النوتس ما كانش مذكور فيها حاجة خالص عن كده حتة drunk، وكان مكتوب بالصريح وبالبولد كده ان father consent for the child، فعشان كده ما قدرت اشرح لها هو كان drunk ولا مش drunk. هو emergency even without consent.
خلاص without consent this very difficult according to this
صلاح
يعني if
I like your answer على فكرة by the way ان انت اكيد you can't say that as long as he consented he must have understood the information and took the decision. يعني هو ده اللي تقدري تقوليه يعني انت ما عندكيش اي information اكتر من كده.
طيب معلش يا دكتور آية، هو حضرتك بعد اذنكم يعني هي الحاله انت حضرتك قلتي بس ان هو كونسنت فور ات، يعني طب ايه المشكله في الهوم اصلا؟ يعني هي ذكرتها الاكتور نفسه يعني.
لا ما ذكرتش اي حاجه، هي طول الستيشن كانت مصممه ان هي متنرفزه متعصبه، جايه اصلا في وشك على الباب على طول، فكانت اول حاجه قلت لها انها تقعد. بعد كده بنتكلم متعصبه عماله تهز في ايدها متنرفزه، كل كلامها على الكونسنت. درانكن فاذر هاو تو كونسنت، انت عايز الكونسنت بتاعي، ما بتتكلمش عن اي حاجه ثانيه. هي عارفه يعني ايه رابشر سبلين، مش مهتمه تعرف ايه اللي حصل للتشايلد خالص.
هو ده communication. He needs to know if you will address her concern.
Discussion will not go by this way. Should be will be repeat again in English. يا اخوانا في ناس معانا شايف عربي. Repeat in English please.
Okay, she has only one concern about the consent of the father. She keep repeating his drunken father consent for him. So do you want my consent now? She know everything about rupture spleen. She's not care about what happened to the child. She's not asking anything. Just keep insisting his drunken father consent for him. You already take the consent from a drunken person. Do you need my consent now? All the 9 minutes the same, and after we finish the point of consent she kept silent and say no thank you, I don't have any other question.
So what we'll do now, Dr. Salah, after this, actor doing like this, يعني it's a simple questions about
the most important thing in communication part is answering patient concerns, whatever the remaining questions, يعني if you will answer or reply her remaining her concerns, answering her concerns or replying her concerns, I think this will be enough. دكتورة هيفاء we will repeat the station again مع 2 تانيين يا مراد لكن بالاستيم القديم.
Okay. يعني ايه الاستيم القديم؟ You mean that the mother will act.
She knows the stem. هي هيفاء عارفة الاستيم. عارفة الأسئلة. كانت عملتها معانا المرة اللي فاتت.
Okay.
Raise your hand and another one will do the station.
Okay. So Yeah, I just have a small comment. It's about communication, about listening to the patient. He needs just the examiner that you have listened carefully and you are responding to the patient questions, just like this. Okay, so now we have Nusrat.
هيفاء will be the actor.
Okay, هيفاء. Okay, هيفاء.
أنا فتحت
And we have Adnan. Okay. From the spare list. Okay. Adnan. Wa alaikum salam. Okay. Are you ready?
Yes.
So it's the same stem again. Okay, but Haifa will act differently this time. Okay. It's
Okay.
it's Miss Brown. She's concerned about
Mr. Salah.
يلا start.
What is about the oldest stem?
الاولد ستيم بتاع السبلينكتومي البيشنت اللي
he means you keep asking the usual questions mentioned in the book.
Okay.
It goes the same way. Yeah. Okay. So you have.
انا طالع من بارت ايه ابنك قد كده يعني مش انت بتقولي السؤال ده مش انت مش انت.
So Miss Brown, you are the actor. You are concerned about your son who has been taken to the operation. Okay. And his father consented for the surgery. Okay. So Dr. Adnan, you can start.
Okay. Hello, hello, Mrs. Brown. I am Dr. Adnan. One of the.
Please, where is my son? Please.
Okay.
I can't believe what happened to him. Tell me, where is he?
Okay, I'm so sorry for your son, Mrs. Brown. Your son has been taken to the theater to be operated. Okay, I want to ask you, what do you know so far about your son?
I actually don't know anything. I have been just called and told that my son has fallen, and even I don't understand what's happening. Please tell me, doctor.
Well, I'm so sorry again, Mrs. Brown, but I have to tell you that your child has fallen while he is climbing frame, and it looks like he harmed himself. And we are sorry again that we didn't contact you before we are taking him to the theater, as is an emergency, and so we take him to the theater.
I can't believe this. I can't believe this. I can't believe that this is happening. Is it serious?
Well, actually, it's a little bit serious because he has ruptured spleen, and which is spleen. This is an organ in his upper left tummy, and
Yes.
we had to take it to operation to fix it.
Okay, so what's going to happen inside the operation? Is he going to die?
Well, we will try to do our best. We will fix the condition, and we hope it gets better, I think.
I can't believe this is happening.
I'm so sorry for your child, but I think we will do our best to take care of your child.
What did his father tell you?
Well, he said this while he was playing in the garden, he fell out and called out in pain. And then he called the ambulance, and she brought him to the hospital. Yes.
Did he tell you that? This is actually not the first time. Every time my son goes there, he's injured.
Oh, this happened before.
Yes, multiple times.
So again, I'm so sorry, but in these circumstances, we will have to call child protection services to make sure that your child will be safe at home and everything okay with your child.
So would you like to tell me what's the function of the spleen you told me about just a couple of minutes ago?
This is one of the defense mechanism in the body, and it is works against certain microbes and certain infections. So we might need to remove it, and this lead us to need to be your child will be vaccinated, and maybe need to lifelong protective antibiotics.
Okay, that will be okay. I hope he still stays alive. And how long will the operation take? Can you go in and check for me?
Well, actually, I can't tell you how much it take, but as the consultant finish, he will come out and tell us what's the condition of your child.
Okay, can you come in and check for me, please?
What?
Can you go in to the theater and tell me what's happening inside?
Well, actually, I'm so sorry, I can't do that. We will have to wait the consultant to get out of the operation, because it's a sterilized area and we can't go in. Sorry.
Okay, so how long will he stay in the hospital after that?
Well, we will keep your child until we make sure that he is in good recovery, and we will not discharge him until we have taken full clinical examination, and also we make sure that his general practitioner aware about any concerns.
Okay, I hope everything goes well. You've mentioned something about something called a vaccine. What is a vaccine exactly?
Well, these are certain vaccines that we give him to patients who taken out or removed their spleen, and this against potential infections.
Okay, so he will not get infections.
We hope so. We hope so, Mrs. Brown. Again, I'm so sorry for
Okay.
that. Do you have any other question, Ms. Brown?
No, thank you. I will just
Please.
stay waiting here.
Okay, if you need anything, just let the nurse call me, okay?
Okay.
Okay.
Would you give him any medications after the young removal of his spleen?
Antibiotics, lifelong antibiotics.
So he will continue with the penicillin for a long time?
Yes.
For how many? For
Maybe
life?
5 years.
So don't attend long life.
Yes.
This is, by the way, done before, and it's wrong.
Yes.
هيفاء انت قعدت بجد؟
لا no.
ماشي. عدنان يا مصراتي.
دكتور.
انت ارثوبيدك؟
لا GS.
يس. ما عندهمش احساس زي المصريين. بس بتحسوه زينا. بتحسوه زي الارثوبيدك. ما بتحسوش زي الارثوبيدك. التون بتاعك يا مفتري. يعني عماله تعيط وتقول لك جوزها ولاد جوزي ده انا احرقهولك ده لو انا اقول لك ده احرق جوزك. ماشي. We discussed about this.
Okay.
We discussed about this. By the way, you answered all her questions, but by very bad way.
Yes.
She's crying.
يعني
She's crying.
you looked as if you are reading from a paper.
I have to practice.
قبل كده وخلتوني وقعت في الغلط وهم زعلوا مني. هم بيعرفوا يمثلوا. هم بيعرفوا يمثلوا اساتذه، انما احنا غلابه.
غلابه يا دكتور، مش عارفين
اللي حصل دلوقتي معايا ده دي سنجل يا شباب. يعني ازاي انشا مظهر يعني
انا I was about to cry يعني.
يعني هي دي سنجل. طب ازاي يعني انشا مظهر بالطريقه دي؟ عرفت منين ان في طفل وخاف عليه؟ سبحان الله. anyhow they are very good. انا حذرتكم قبل كده وقلت لكم. انا قلت لكم قبل كده وفي الاخر ما ماشي. ماي كومنت سبيشالي انا حاسب لك يا مراد. ماي كومنت تقول لي يور تون فويس. This يلا مراد your comments.
Thank you Dr. صلاح. برضه هي the same problem, the tone. يعني empathy have to be shown in your tone of voice. And when the patient came to you, she was anxious, she's crying. You started by telling her your son was taken to the operation. The first thing you have to prepare, tell her first, I am sorry, what do you know about this? Ask her to sit. If she was standing, offer her some water. and then start. She may refuse to talk to you, or she's angry while she's standing. Never talk to the patient about the details when the patient is standing. Ask her, can we sit down and discuss it? I will explain everything to you. Don't tell her directly, your son in the operation, okay? It's the same problem, I know, okay? Then you tell the patient have ruptured the spleen. Again, you can tell her he's hurt his spleen and then explain the spleen, okay? And be honest. She told you, she asked you, can he die? Would he die? You told her, no, we will do our best and I hope that he will be well. No, tell her this is a very serious situation. Actually, be honest.
Okay.
Okay, we will do our best, but still there is there is risk.
Yes.
On his life. Okay.
Okay, doctor.
don't try to promise حاجة أنت مش قدها. Okay.
Okay.
Thank you.
Okay, this one of the station of breaking bad news. Okay. In a patient, what I wrote in what I shared in the screen, if a patient or relative becomes angry in the OSCE, apologize immediately, regardless of how unreasonable they are being. They are in difficult situation, and apologizing even though you are not at a fault, this would be very important. Always remain calm and professional throughout. The actors tend to be very good and are aiming to provoke a response for you. Okay. In delivering bad news, very important. In OSCE, as in real life, it's essential to deliver warning shot first. Yeah. After this, it's best to be upfront with the information rather than skirting around the subject. I don't know, he may die. This not, you should be going in front directly. Okay, remember to leave silence after delivering bad news. When she's crying, I want you to be silent. Then after she finished, give her some time, offer for her tissue, sit, if she's sitting, it's okay, and tell her, I am so sorry for that, let me explain for you more details about the situation of your child. You can calm her, only calm her, okay? Regarding of the question, could he die? I shared it here, could he die? And this is the station, could he die? You can explain a ruptured spleen is a serious condition, and that is why we acted so quickly in getting your son into the operating theater. He is now in very good experienced hand. You explain first that we are doing our best, and we hope it will be improved. And last sentence, the conditions remain serious, and there is possibility he could die from this injury. So I will mention he died or not. Don't mention this word except if she will ask you, could he die? تمام كده؟ ما فيش مناديل يا ابني، ادي لها كمك خد مساحه يا ابني.
هي بس صح what Dr. Salah said فعلا. It's very important that to leave a period of silence. Don't feel obliged to fill in the spaces with talking. Okay. Great. Next,
this is the station you read it from this paper also. It will explain everything for you. The stem of Aya, this is done in UK, by the way, done in UK. So maybe they have some updates doing it. So this is why we did the old stem or all the other questions, because it's very common to coming everywhere. And it came in Malaysia last week by this way exactly. Okay, not like the stem of Dr. Aya. تمام كده؟ يلا اللي بعده.
Okay, so we have Broma and okay, Adnan, he did one already now. So we can take Sarah. Okay. And Broma.
Good evening.
Good evening.
طيب هحلها لك يا رامي. خد تيشو في جيبك. When you are going for the exam, take tissue in your pocket. تمام كده؟
Okay. And
if she asked for tissue and I haven't, take
we have Mark كمان. We can take Mark. Okay. Good evening, Mark. Are you here?
Yes, I am. Hi.
How are you doing?
Not too bad, thank you.
Great.
You?
Okay. I'm fine.
Yeah.
Oh, okay. So you will be the patient for this one. And Sarah, are you here, Sarah?
Oh,
yes,
God.
You are. will be the doctor. Okay.
Okay.
So we will be discussing the station of self-discharge.
Yeah.
You are a young patient involved in a motor car accident, and as a result, you suffered a large splenic hematoma.
Yeah.
You were admitted and observed in the hospital for 48 hours.
Yeah.
You stayed stable, but it was planned that your consultant will keep you under observation for a further period, and splenectomy will be done if the hematoma ruptures.
Okay.
But the patient wanted, Sarah, it's the stem is for you also. The
Yes,
patient
yes.
wanted to discharge himself
Yeah.
because he has important interview on the next day, and he has many financial problems because his wife is recently diagnosed with cancer.
Right.
Is
Okay.
the stem clear?
Yes.
Yes.
Perfect. So, Sarah, you can start.
Hi, my name is Sarah. I'm one of the surgical doctors. Can I ask your name and date of birth, please?
My name is Mark, and my date of birth is 1st of July 1986.
And how old does that make you?
Makes me quite old, actually, maybe 45.
Okay. Well, nice to meet you, Mark. I understand that you have expressed your wishes that you want to leave the hospital. May I ask the reason for this?
Yeah, I think I'm quite well. Been in the hospital for 48 hours already.
Okay.
I'm keen to go home. I don't see why I should be in the hospital. There's nothing being done for me. I'm wasting a hospital bed, so I just want to go home.
Okay. Well, first of all, you're not wasting a hospital bed. Please do not feel that way. And secondly, is the reason because of the injury you had to the organ in your tummy. The reason why we want to keep you in to monitor you and keep an eye on you. Because of the injury you had, you're quite well at the moment. However, because of the collection of the blood in your body, that can burst and can explode, and that will make you quite unwell when you're at home if you would like to discharge.
Sorry, what do you mean by the collection in my tummy can burst?
So because of the injury you have one organ in your tummy. It's called a spleen, and this organ in your body has got a collection of blood around it. And this collection can burst at any time, and that's why we would need you to stay in hospital to monitor you observation. And if the collection bursts, we will take you to theater to do an emergency surgery.
Oh, you want to operate on me, doctor?
No, we will not be operating on you if the collection of the blood wouldn't burst. However, if it does, then we will need to rush you to the theater.
It's already 2 days and it has not burst. I think it will not burst. I want to go home. I have a meeting to attend.
Okay. Well, for example, for your meeting, is it an in-person meeting or is it over online?
Yeah, and I've actually been waiting for this meeting for a long time. I have already postponed it once, and I don't have a job now, so it's very important that I go for this meeting. It's face-to-face meeting.
I understand. It's quite an important meeting for you. What would be able to help is that we can provide you with a letter and contact the department to let them know that you're in hospital. So you do have a valid reason to have a different date for your interview, or the interview can be done online.
No, that's fine. Very kind of you, but I really need to get this job. And I've recently lost my wife as well. Things are very difficult. So it's
I'm really sorry to hear that.
Yeah, so I really have to do the interview so I can go back to work immediately, and then I'll make some money to help my family.
Okay. So if you really want to leave the hospital, then I would need you to sign a form for us so that you understand about the risks that we have discussed today.
That's okay. Can I have this form and sign it immediately?
Yes, sure. And would let you know that if you are at home and you are starting to feel unwell, you dial 999 and you seek the urgent medical help.
That's
if you're
okay,
feeling
doctor.
unwell or
All of
dizzy
this, yeah.
and you get tummy pain.
Okay. Thank you very much, doctor.
Okay, I'll bring the form out to you. Thank you very much.
It's a pleasure.
Okay, both of you did well. Sarah, you introduced yourself. However, you don't have to ask the patient about his age. He's admitted and you are taking care of the patient, so you are supposed to know his age, at least. Okay. And again, you say the hematoma would explode. Okay.
Yes, I don't know why I said that.
I mean, that's why I kept asking you again. Are you saying that? I thought you would change your mind.
It's huge. It's not a bomb. يعني. Okay.
Yeah.
And also, you have at the last to check for capacity.
Capacity. Yeah.
Okay. Do you understand? And can you repeat after me what I've just said to you? Okay. And your tone of voice. I'm not saying it's not nice, but it's again, it's monotonous. Okay, change it. It's like that. The tone in the late night in radio. That's a very monotonous voice in the radio at night. It's nice, but in the exam, try just to change your tone of voice.
Sure.
To show that you're reacting to the patient. Oh, I'm very sorry to hear about that.
Yes.
Well, okay.
Yes.
It's called mirroring the patient. Okay. But overall, you done well, both of you actually. And Mark, you are a great actor.
Yeah,
Thank you very much.
Sorry, Mohammed. What's my doctor's name?
Sarah.
Sarah, is it?
Yeah, thank you very much for being a patient.
Yeah, Sarah, a bit of advice for you. So when I said that I've lost my wife and then I want to go home and work, you need to advise me that unfortunately, yes, that's good. But if I'm not well and I could get sick, I will not be able to help my wife in any way. So these are things you need to mention to the to the patient. And then when I said I want to sign the form, you were too quick to offer it. You
were happy actually. That's why I told her ask for capacity to give the patient. The idea from asking again for capacity, that you check the capacity actually and you give the patient a second chance to say the words by himself, to reconsider.
So that they understand more. Yeah.
Okay.
Yeah.
So, but you were very happy. Okay.
I think he said his wife died.
Yeah, my wife died, had cancer. I think it doesn't matter really, but anyways, yeah, fine. But you did well otherwise.
Thank you very much.
Okay.
Thank you.
Thank you, sir. Thank you, Mark.
Thank you. I'm happy to be a patient if you need any.
We have one question because they are waiting out on bath. Yani if you can offer for him, if insisting, if his wife she has appointment for the clinic for follow up for her breast cancer, or he has interview. So better here to offer also at the end. We can offer for you out on bath paper to go for your appointment and come back. Okay.
Yeah, that's very true. Yeah, you can always do that.
Yeah. But she told about you can do it online. Yani she tried to solve it by some mean. Yani she addressed that by some way, and he told her the wife died. So close it.
So don't keep the stem as usual, because maybe actors he has some things to be directed to tell you out of the stem.
So just try to listen. Communication about listening.
Yeah.
Thank you very much.
Thank you both. Great. So next we have Marwan and Rami. Marwan and Rami.
All right. Am I free to mute myself now?
You need to mute yourself? Okay, you can, Mark.
Okay, all right, cool. Thanks. Bye.
We will see you again, I think.
Yeah.
Okay, so we have Marwan and Rami. Raise your hands, please. Okay, we have Rami here, and we need Marwan. Ask on mute. Okay. So No, Marwan. Okay, we have Muhammad Omar. Okay, Marwan, are you here? Hello? Marwan? Rami?
أيوة hello دكتور مراد. Yes, I am with you.
How are you?
Yes, I'm fine.
Great. Okay, so we need Muhammad Omar. Okay, again, ask to unmute. Please, Muhammad Omar, unmute yourself. Okay. Muhammad. Hello.
Hello.
How are you?
Hello. Yes.
Okay, I think you had a bad connection, so you can join later. Okay, but try to fix your connection. I'm sorry. Okay, so we need someone new to participate. Okay, we have Ahmed Wahba. Ahmed.
Hello. Yes, I'm with
Hello.
you.
Okay, great. Okay, Ahmed. Yeah. So you will be the patient, okay? And you have a great chance to be our star today, okay? So we have counseling a patient. Sorry, I'm sorry. We have angry patient because of postponed arthroscopy. You have a noisy background, please.
I'm now okay.
Okay, great. So Rami, you are the doctor and Ahmed is the patient.
Yes.
Okay, so you have a patient has a post-traumatic meniscal injury and his arthroscopy was cancelled once before and now again it will be cancelled because the consultant has been called for an emergency and the patient does not know yet that his operation was cancelled and he's waiting for you. Okay, you are the orthopedic SHO covering for the consultant. Okay.
Yes.
Have you heard the STEM?
Yes. Please,
Okay,
Dr.
so,
Muhammad, what is the name of the patient?
the patient is called John.
Okay.
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 Yes, you can start.
Okay. Good morning, Mr. John. My name is Ram Salama. I am one of the surgical. I am the orthopedic trainee covering for my consultant.
Good morning, doctor. Good morning, doctor. Now I have informed that I didn't have operation schedule. What is this? What is happening?
Oh, I am very sorry. I understand that you are frustrated, but unfortunately we had an emergency situation, so my consultant will not be able to do this operation for you right now.
No, doctor, I have to do my operation now. I bought all of my life on this time. Please fix it.
I'm very sorry, Mr. John. I can understand your frustration, but unfortunately, in cases of emergency operations, the cases of emergency have the priority to be operated upon them. So he will, my consultant will not be able to do the operation for you right now.
Doctor, please. Now I want to speak the consultant. As you are not the consultant, please get me the consultant now.
Oh, I understand your frustration, Mr. Jordan, but I cannot talk to him right now because he is in the operative theater, and he will not be able to pick my call.
Okay, call another doctor, please. I can't go now without operation. Please.
Okay, again, Mr. John, I understand your frustration, but first of all, you have the right to choose your doctor or change the consultant. But unfortunately, if you decided to do that, we will have to go to restart from the beginning, and this will be a very time-consuming for you. I'm afraid from this.
Oh my God, doctor. So please, now fix that. You know, do it for me, please. I know that you are good doctor here.
Thank you, Mr. John, but unfortunately, I am not authorized to do these types of operations. Only consultants are authorized to do these operations.
Oh my God, doctor, but my knee is very painful now. Okay, just please give me another date, but very sooner.
Okay, I will talk to my consultant and I will explain the circumstances, your circumstances for him, and I will try to prioritize you in the nearest list coming.
So if the nearest list come and can you guarantee that I will not be cancelled again?
Again, Mr. John, I will explain the circumstances, and sure you will have the priority to be operated first in the list. But in case of an emergency happen, your operation can be cancelled again. I'm not sure 100% that you will do the operation.
So if this delay come again and again, will this affect my knee?
So, Mr. John, your knee, as long as you don't use it in vigorous exercises or lift heavy objects, and you do the operation, your knee will be in a good condition.
Mm-hmm. So how can I walk now with this pain in my knee?
I can prescribe, excuse me, Mr. John, what do you take for as analgesia for this pain?
Yeah, I don't know, some doctor prescribed me a paracetamol and some local cream.
Okay, I can prescribe to you stronger analgesics such as diclofenac. And in case of you have stomach problems, I can prescribe some medications to decrease the acidity in your stomach. Or if diclofenac doesn't work with you, I can prescribe stronger analgesics such as codeine, or I can also refer you to the pain management team. They can prescribe stronger analgesics.
But I already tried some medication and some exercise before, and I'm also in severe, and this affects my work. How can I work this until the next operation?
I can write to you a letter to your employee to inform him about your case and ask him to extend your sick leave if this is suitable for you.
Doctor, please, this is not suitable for me. You postpone my operation. I now file a complaint to this consultant.
Sure, you have the right to take an action or to complain as a consultant, but Mr. John, believe me, these circumstances are out from our hands. It's an emergency case, and we cannot delay this case. But if you still insist on talking to or taking an action, you can consult the PAL's office. They can help you and advise you about this situation.
Okay, so after I finish this all and I have a second schedule for my operation, can I walk again? Can I stay it?
Yes, we will do. You have to know that you are in a good and experienced hands, and we will do our best to ensure that you regain your full health and full power. And but I cannot assure you 100% for the future of your knee until the operation is being done.
Okay, doctor, now I'd like you to guide me where can I fill my complaint, please. And thank you.
Again, I'm sorry to hear that, and this is the PAL's office in the reception downstairs.
Okay, thank you, doctor.
Thank you very much, Mr. Joe.
Okay, doctor. It has been a very long period. I have even forgotten what is the operation. I have been told that I have a tear something called the meniscus, something like this. I don't know what is this and what is the operation.
You have got something called a tear in the meniscus, and the operation is called the arthroscopy.
What is the meniscus? Anyway.
The meniscus is a substance is located inside the knee, and its function is to lubricate or facilitate the movement of the bones inside your knee, and keep the movement easier inside your knee. And the operation scheduled supposed to be done to you is called arthroscopy.
What does it mean?
The arthroscopy, sorry.
Yes, I don't know what is this.
Yes, the arthroscopy is an operation, includes a camera which goes inside your knee joint to visualize the tear. Also, this camera will relay an image to a TV screen.
So you are cutting through my knee?
I'm afraid we are going to visualize what is inside your knee, and if there is a cut, we can do some interventions.
So I mean, you're making large cuts through my knee. There will be a very big scar or what?
No, it's a small incision for the camera, and for maybe for small instruments to.
Doctor, you mean that it will be a keyhole?
Yes.
Okay, now I understand. Okay.
حرامي كي هول وانتهت الامور على كده، جابتها كي هول، احفظ الكلمه كي هول وانتهت الامور على كده وخلاص.
هي كده هيفهم. Okay, he will understand. He wants this word. And okay, so doctor, you said you will give me diclofenac. So you want to hurt my stomach, my tummy?
I can prescribe you some selective analgesics which cannot hurt your stomach. This is an option. The other option can give you some medications to reduce the acidity of your stomach, not to hurt you in the future.
But I have taken these medications before and it hurt my tummy already.
So the other solution is to give you selective analgesics not acting on the stomach.
What is this?
It's something called antico.
It didn't work for me either.
Oh,
I don't want this group at all.
I'm very sorry to hear that.
So do you have any other option?
Yes, I will talk to my seniors and will confirm the other options, which include the weak opioids such as the codeine. Also, we can if this doesn't work.
So you want to make me addict? So I am now hurting my knee, I can't walk, and I will be addict.
Oh, I'm sorry to hear that, but believe me, Mr. John, the opioids are only prescribed for persons who are in pain, and this will not cause addiction. Also, we prescribe them in small dosages, so the effect of addiction will be very small.
Okay, so there will be addictive effect, as you saying. The effect of addiction, you said it yourself.
The effect of addiction is very small because you are in pain, and also we prescribe small dose. So if you want to stop it, it will you can stop it and will not cause addiction.
Okay, doctor, I won't take them. I don't want to be addict. Thank you.
Thank you very much.
Okay, never say addiction. Okay.
Yes.
Okay. So I have some comments.
I have some questions.
You can continue.
You told me that you will extend my sick leave. I started to gain weight.
Sorry, Dr. Sah, extend what?
You wanted to extend my sick leave.
Yes.
You told me that because of the pain in my knee. But really, now my weight started to be gained.
Oh, I'm sorry to hear that. I'm sorry to hear that, Mr. John. I can refer you to some dietitian or nutrition specialist who can guide you through a plan to reduce your weight. Also, you can try non-weight-bearing exercises such as swimming or have a little effect on the knee, not to lift heavy objects during this sport to reduce your weight. Also, we can try physiotherapy to strengthen the muscle around your knee during these exercises.
You know how many times my operation canceled?
Yes, I know. I'm very sorry to hear that, but as far as I know, it's the second time.
Okay, please concentrate how many times the operation canceled, because you have three things done in this station. Number one, how many times the operation canceled? Number two, what is the name of injury according to MRI? It's a meniscal tear, medial or lateral meniscus. Please confirm which one. Plus arthroscopic surgery, layman language, how to be done. This is the new questions. This is the new questions only. تمام?
Okay, I have a comment to Dr. Salah. Zaki is asking يعني in the real exam actor بيبقى this angry? No, he will be much more angry. Okay, I had the station myself, and the actor will be very, very angry. And by the way, the station, in the start of the station, he will be quiet, he will be sitting and calm, and he's just waiting. And when he sees you, he will, okay, doctor, are you here? I am ready for my surgery. He did this for me. Okay, then you will tell him, okay, that your surgery have been postponed. Then he will start to get very, very angry. Okay.
ما شاء الله الاكتور بتوعنا كويسين جدا. Our actors they are doing great by the way.
لا بس انا في الامتحان فعلا والله كان انجري جدا. انا في اليوم بتاعي I remember انه ولا واحد كان البيشنت satisfied at the end except for me actually يعني.
لا ما شاء الله ممثلين رائعين. الشباب اللي معانا ممثلين رائعين ما شاء الله. الواد اللي معانا هيخلصوا MRCS ويروحوا يقوموا معهد التمثيل. وذكي يروح يشتغل في كباريه. هم يشتغلوا ممثلين وذكي في كباريه. نهايتك ده نهايتك.
Okay, but he did very well. وانالجيزيا always say painkillers و use keyhole surgery. We don't say to the patient you understand. This is annoying. You will never understand how he feels. I can see how this is affecting you, how this is affecting your life. I can see how difficult is your situation. So use always I can see, but don't say I understand. Okay. So
how many times you canceled? The name of operation, the name of that is finding meniscal tear, and it is the name of operation arthroscopic.
Okay, great. Okay, so Dr. Salah, we can move to the next.
Thank you, Dr. Murad. Thank you, Dr. Salah.
You're welcome. You did very well. Okay.
Thank you.
So next we have Mark again and Hiba. Okay, what happened? Okay, so Mark and Hiba. Mark, okay. And where is Hiba? Raise your hand, please. Okay, Hiba also, I'm sorry. So Hiba and Mark, are you here? Mark.
Are they looking for me? John, you guys, hello.
Welcome again, Mark.
Oh, thank you. Is it my turn now?
Yes, you are the doctor now. And Hiba, are you here, Hiba?
Yes, I'm here. Hello.
Welcome. So you will be the wife of a patient. Okay. So you are angry wife for a patient. Mark, you will be the doctor.
Yeah.
We have a patient who was referred by his GP for ascites.
Yeah.
Peritoneal tapping was done and showed some malignant cells in the cytology, and tumor marks were requested, but the results are pending. The patient was planned for CT.
Sorry, say that again. Peritoneal tap was done and
the result of the cytology showed some malignant cells.
okay.
Tumor marks were also requested, but the results are pending.
Mm.
The patient was admitted to your hospital and he was planned to do a CT today, but your CT machine is broken down. The engineer will be repairing it tomorrow. So the CT is not expected to be working until the next week. The radiologist, however, has offered to do ultrasound of the abdomen instead today. Your consultant also was supposed to speak to the wife to explain everything to her, but he had to go in an emergency. And your registrar also has written in the notes that if the patient develops shortness of breathing, okay, you can consider doing therapeutic tapping. Okay, so you are the SHO. You are supposed to speak to the wife and explain to her what happened. She is called Caroline.
Caroline.
Yes.
And what's the husband's name? Or no, not important?
His name is Jones, or of course it's important.
Yes.
Yes, to call him with his name. It's more better. Okay, you can start.
Hello.
Hello.
Can I confirm you're Caroline?
I'm Caroline.
I'm Mark, one of the surgical doctors here. I can confirm you are husband to Jones. Is that correct?
Yeah, finally, we are waiting for 6 hours to do some investigation. I don't know what's the name of the investigation. So what happened?
I'm so sorry for the delays. I'm here to speak to you about your husband.
You should be sorry. Yeah. Okay.
I must.
So we can do the investigation now.
Sorry, say that again.
When we can do this investigation?
Before I can tell you all of that, can I first tell you that this was Mr. Abman was supposed to speak to you. Unfortunately, he can't speak to you now because of emergency. So he's asked me to come and speak to you and update you about everything. Is that all right?
Who is you?
I'm one of the surgical doctors at the moment.
Okay, and you know everything about my husband?
I must say I know a lot about it, that I think it should be okay to update you enough about it. Yes.
Okay.
All right. Before we go on, how much do you know so far about what's going on?
I don't know anything. No one explained anything to me.
Okay. That's all right. In the first place, yes,
okay.
As you probably are aware, your husband has been brought to us because of a collection or possibly a fluid, and we've done some investigation. The investigation involved taking some of that collection and investigating it further in the lab. Does that make sense?
What's the investigation that has been done?
We look at the cells and then try and look for the cause of this collection.
Okay.
Unfortunately, some of the cells has come back as having some cancer cells.
What? My husband has a cancer?
At the moment, I'm really sorry to present to you this information. It's a bit, it's not complete information, but the cells appear to be malignant. Sorry, not the right word again, it's cancer cells. But we need to do further investigation to complete the diagnosis.
And what is that investigation?
It will involve some imaging. He will need a scan of his tummy and other part of his body. We are planning to do this scan today. Again, sadly, our scanner has broken down, and the scan will not happen, but we have an alternative to do it for now, as per our.
And if the alternative will do the same work,
Sorry, say that again.
the alternative will do the same work.
I'm afraid it will not give us all the information that we need relative to the scanner that we wanted in the first instance, but it will give us some
So
information.
my husband will die until you fix your machine, or what you call it, to do the CT, or what do they call it?
Again, I apologize, but it's premature to say that your husband will die, and we don't expect him to do that. We think that within the time frame of and his clinical presentation, ultrasound, as recommended by radiologists, would still be appropriate. But we would aim to do the scanner as soon as possible. There's a plan for the scanner to be repaired tomorrow. Hopefully that goes ahead and everything comes back to normal, and then we will do the scan for him.
So you can assure, you can guarantee that the CT and the scan will be done tomorrow?
I can't say for sure 100%. I can't give you a guarantee. I can't promise, but they will do everything they can to have it done. In very rare situation where this can happen, we can have other alternatives and other ways to have it done. But when we get there, we'll have this discussion.
So if I want to do this scan, what's the alternative to do it? I can take my husband to another hospital to do it, or what can I do? Because you see, he is gasping and he is not good. He's not in a good health now, and he's going to die. You see how is his situation?
I appreciate his situation is critical. Yes. Now let me answer the first question first, and then I'll talk to you about the gasping and what we can do to help him. In the first instance, yes, you are right that the scanning can be done in a different hospital. And yes, we can help arrange that and speak to our sister hospitals that we can have the scanner done. In terms of his gasping and his struggling to breathe at some point, we can obviously do a lot to help him if it becomes worse. We can take out some of the fluid collection that's in his tummy, which is the cause of this gasping, and that should help make him slightly better. It's a temporary solution. It's not a permanent solution, but it's something that we can obviously do. Yes, that's where we are now, and at the moment, we appreciate that. Yes, he needs.
Okay, so I can carry my husband and to go to other hospital by myself?
No, we would make arrangement for that if it becomes necessary. But at the moment, not yet. We wouldn't.
Hello?
Sorry, can you hear me? Hello? Hello?
Okay.
Yeah, we would normally make the arrangement for transport. You would need the right transportation with the right equipment, right medical practitioners in, for example, an ambulance, if that becomes necessary. But now we'll start with the ultrasound, and obviously we'll be guided by his clinical presentation. Does that help?
Okay, if we could manage to do this CT and it turns out it's a cancer. It's a cancer. What you will do for my husband? He will die from this cancer?
Again, it's difficult to say. As you probably are aware, it's on a different patient to patient. Different people are treated differently. But on a rare occasion that this is the case, would usually be discussed in our multidisciplinary team, which involves a team of experts and specialists who deal with cancer and its management, and they will come up with the right treatment to manage your husband.
Okay.
Any other questions before we proceed?
No, just I want to make sure that he can do this investigation as soon as possible, because I'm worried about his situation. That's it.
I appreciate the concern and your distress, but yes, we'll do that as soon as we can. And I apologize again on Mr. Mann's behalf for not coming to speak to you. As soon as he's back from his emergency case, I would have a chat with him, and if possible, he would also come and speak with you. Obviously, you can stay here.
I have one question, doctor.
Yes.
My husband's brother is outside. Do I need to call him and tell him that his brother is dying and he has cancer and he should come to see his brother before he died?
I appreciate that you're concerned that he's probably in the last stages of his life, but and in times like this, having any family around, it's always helpful. As to whether he needs to be told, I think this is something that obviously, if your husband is happy with it and the family is happy, I don't see why not. But again, we have very good social.
Sorry, doctor, you said last stage of his life, so he's going to die.
No, I might say that it's difficult to
Yes.
say. I didn't really say that he's going to die. I think what you had probably said that in his last stages, that's what I meant by if you think that you feel that way, we don't expect him to die, and we can say it's difficult to say. But if you think that he needs support, then yes, I think any family support is important.
Okay.
All right. Thanks again for your time and your cooperation.
Okay, thank you, doctor.
Thank you too. Bye.
Okay, thank you both. Thank you, Mark. You have done very well, actually, and until the end.
Yeah, I don't know what I mean.
What are you saying, man? Last days of his life.
I think I missed my words there.
It's not.
Yeah.
Yes. I liked your tone of voice. You were calm. Okay.
Yeah.
You were responding appropriately to the patient questions.
Yeah.
You answered her questions right. I had more questions actually, but when she asked you about transferring the patient,
Yeah.
you said we will arrange it. No, you have to tell her we usually do these investigations in the 2 weeks period, because this is the period that you are supposed to do it in the UK. So you have to make this. Okay. But if we felt that it will take longer than this, we will transfer him.
Okay.
Okay.
Yeah, I think you're right. Yeah, totally.
Yes.
Yeah, totally right. Yeah.
And she may ask you about, you do surgery for him?
I don't think we would do surgery for him. But again, this would be discussed thoroughly in the multidisciplinary team. I think probably that's what I would say. That
so for the moment, what can you do to help him?
For the moment, we'll be guided by his clinical presentation. If he has any shortness of breath, then we would take some of the fluid that is causing this burden on him. So we'll manage his pain and make him as comfortable as possible.
Yes. So it's a very important point. Every question is addressing something.
Yeah.
So this question is addressing palliative treatment. Yes, you will give him pain. You will give him nutrition, okay, pain relief, I mean. And the other question about his brother, this is called near end of life decisions. Yes, the answer is helpful having family support. However, this is up to him, as you said. Okay. And when she asked about, does he have cancer? Yes, you said we don't have all the information to answer this question. All we know is there is malignant cells. Okay.
Yeah.
But I liked actually your tone of voice.
Thanks.
You sounded very calm. You responded appropriate to the patient. So well done. Dr. Salah.
No, they did great. He did great, by the way.
Yeah, I liked his tone of voice actually.
Yes, except only the question about is it cancer? Is it cancer? And the most important point in this station, she will insist, is it cancer or not? So try to tell her the truth about what you have. We have only the acidic fluid, which revealed malignant cells. which indicate this may be a cancer. And this is why we are requesting more and more. Requesting more and more investigations. This is why we asked for CT. Even we can do some lab investigations to confirm from our diagnosis, and then we will discuss with you all these results. You have question here asked before. She told, okay, so doctor, if this in this stage, like I understood, he has a brother working in America, and he has a heart disease. Could I call him to come and see him or not? What's your advice?
My advice will be again the same. I think I honestly feel what you're going through, but as to family support, it's always advisable. Would obviously have very good social services here that will provide all the support, but any family support that can come around would also be highly recommended. I think that's probably what I would say. But the decision again depends on the husband because of patient confidentiality and everything like that. So I think that's what I'll say.
Mustafa told you, not my business. Okay, the answer to the question, it will be, yeah, okay, according to the situation of his brother, and also according to his health status, if he will take permission from his consultant, he can come, no problem, he can come.
دكتور صلاح انا بس عندي كومنت على this question. هو بيأدرس اللي هي زي ما بقول لحضرتك near end of life. You have to involve the patient in the decision. This is very important. يعني it's written. You have to involve the patient in the decision, okay? And as you said, it's important to have family support, okay? And it will depend, as Dr. Salah said, as his brother condition. But mention that we have to involve the patient. This is very important. Okay? Thank you. Thank you, Mark.
Thank you too. All right. Yes.
Bye. Dr. Salah, anything else to add?
No,
okay.
not.
So next station we have Widad and Aya. Widad, raise your hand, please. Widad, okay, she's here. Okay. Hi, Widad.
السلام عليكم دكتور.
وعليكم السلام ورحمة الله. الحمد لله. ايه الأخبار؟
دكتور صلاح إن شاء الله بخير.
تمام الحمد لله اللهم لك الحمد.
Okay, عايزين we need Aya. Okay, so
By the way, I have some updates in history taking. I will try to do forward for this message after finishing of communication tomorrow. I will forward the updated questions only in history taking because I'm not joining the history taking with you. So I will share it. Don't worry. I have some few questions only. It will be shared inshallah in notes group. So please revise notes group. I know it's a stressful time for people going for UK. So I will forward this message inshallah.
I will unmute you, Aya. Don't worry.
Yalla, we can start.
Okay. Aya?
Thank you, Doctor.
You're welcome. Okay, so again, you are the patient. So
okay.
Widad, you Widad, you are the doctor. Okay, so we have the last station. We have counseling a
Who's the
patient.
patient? Who's the patient? Who's the actor?
The actor is Aya.
ايه طيب
ايوه
بص حاولنا نخرج من عبايه الانشس ماذر ودندنك دورة واحد أعمى واحد كفيف.
شكرا.
عشان لازم انت عارف لازم التنوع في الادوار.
Okay.
Okay, so we have a patient legally blind, has a recurrent inguinal hernia, surgery done 30 years ago. You see that the patient has a stick, he has dark glasses. Okay, patient had mechanical heart valve replacement and he's on warfarin and he's planned for operation and he needs stopping warfarin before the surgery. He is a bit anxious to stop his warfarin and he has been already discussed this issue with the consultant. Okay, however, he's still anxious and you are going to explain it again to him. Okay?
What's his
So,
name?
his name is James. Okay? So you will enter. The patient is sitting on the chair and he has dark glasses. So you can start.
Hello, Mr. James. I am Dr. Awidat, one of the surgical doctors in this department. I have been told today you are having some concern regarding stopping your medication that you are using for blood thinning. Can you tell me more about this concern, please?
Hi there. Again, please. Who's there in the room?
I am Dr. Awidat, one of the surgical doctors for this
Oh,
department.
nice to meet you, Dr. Dad. Yes, yes.
I have been told that you have some concern about your stopping medication, pills you are taking for blood thinning before operation. Can you tell me, please, about your concern?
Oh, yeah. Regarding this, I don't know. They want to stop my medication, but I don't think it's a good idea.
Okay, let me explain this for you. You are taking this medication, which is named warfarin. This medication is used for blood thinning. It will prevent.
Yes, it's
yeah,
because my doctor gave it to me because I had this surgery in my heart.
Yeah, it's given to prevent you from forming clots in your artificial valve. So
yes, I
yeah,
think so.
yeah. The problem, these pills you are taking, it's taking long duration of action. We need to stop it before operation, and to eliminate its action before 5 days because we are fear of we are fearing of bleeding intraoperative and post-operative. And
No, I
sure
don't think it's a good idea, doctor.
Yes, we will not stop it like this, and we will not let you without protection. We will stop warfarin, and we will start another injectable medication called the heparin. It is the same action of warfarin, but it is take shorter time than warfarin. And we need to stop it only 12 hours before for your operation. So this is good choice for you. We will not let you without protection regarding this condition.
I'm sorry for that. Do you mean that you're gonna to give me another medication other than the one I'm taking?
Yeah, we will replace it. We will stop warfarin because we will stop it 5 days before the operation to eliminate its action, and we will give injectable heparin. This is we will give, and we will keep you under monitoring. And with the same action, it will protect you from forming forming clots.
Okay, but
it has the same thinning effect of their blood.
How suppose I took this injection?
You will be at hospital for taking this injection 5 days before operation, and we will monitor the effect of this injection before operation also.
Oh, should I stay in hospital all those days?
Yeah, this is better for you because we need to monitor this effect of this thinning medication for your blood before operation.
Okay, but I think it will be difficult for me. 5 days is too much to stay in the hospital.
Actually, regarding this is your condition, is someone can give you this medication at home? This injectable at home?
No, I don't have anyone at home.
So better for you to stay at hospital. You are under our eyes. We can keep close eye for you. We will take good care for you before your operation. We'll start this injectable, and we will follow by some blood test.
It seems a trouble for me to stay in the hospital all that time. I'm not comfortable with the idea.
It is for your best interest if you stay at hospital.
Is there any other choice?
There is another choice if someone can give at home, but I don't think this is good for you because this is need to be taken regularly at same time because we are fear of you should take we should take good care for yourself. This is we should notice that this is good for you. We don't want some clothes to be happen for you again, and we also need not to give more dose as to give more bleeding. So we need to be monitored at hospital.
I see. I understand. So there's no any other option, like someone can give it me at home.
This is a good option for you is to stay at hospital. This is a good option for you. Also, after operation, we can resume warfarin again till we with heparin till we make sure that it is warfarin is gaining its a thinning effect for the blood.
Well, so I can take my medication again.
Yes. After operation, you can take.
After operation, how can you make sure that it's regain its function?
We will follow by some blood test, regular blood test.
Well, okay.
So I will summarize what we have gone through to make sure that you understand what I told you. Okay.
Okay.
So you will be admitted for 5 days before the operation to eliminate the action of warfarin that you are taking for your blood, for thinning of the blood regarding your artificial valve knot, and we will replace it by heparin. We will stop heparin 12 hours before operation, and we will regain using for you your pills before, which was heparin, which was warfarin after operation, and we will test for its action till it will regain its action with heparin after operation.
And one further question, because you said so
Yes.
many information. I'm sorry, I didn't retain all of it. So, is it why we have to stop the medication again? You told me.
No, I didn't
Before
tell we
the
have
operation.
to stop
Why not?
before operation because of fear of bleeding, because it takes long time long action time for warfarin.
got
We
it.
need to stop it before operation by 5 days because of fear of bleeding, intraoperative or post-operative bleeding.
Okay, I got it. Thank you.
You're welcome. You're always welcome.
Okay. Thank you.
Thank you. Thank you, Mr. John.
Okay, doctor, you told me that you will do some tests to follow the effect of the drug. What can you tell me what is the name of this test?
It is name INR test.
Okay, doctor. Okay, thank you. And I have a problem. I have a cat I have my cat. I can't leave her alone.
No one there can take care of her.
I am afraid not. I am living alone. No one. I don't
So I
have.
will discuss this issue with social worker to find someone to take care of your cat.
But it would help a lot if you find someone to give me the shots at home. Do I
But we
have
need
to
to
stay in
monitor
the
you.
hospital?
We need to monitor you also.
Okay, for what?
That's
I have been taking my medication for so long and nothing happened. You said this drug is much safe. It doesn't cause bleeding like the one I'm taking. So why you are keeping me in the hospital?
because of your condition. This need to be stayed at hospital.
Okay, doctor. Thank you.
Welcome. Most welcome.
Okay. دكتور وداد thank you very thank you. يا باشا نقول البوزيتيف الأول. We say the positives. Okay, Dr. وداد, you did well. You listened to the patient. You were calm. You kept explaining to the patient. Okay. What needs to be done better, as Dr. Salah said, he kept asking, stressing on one question, and it seemed to be very important to him. that it's troublesome for him at stay at the hospital. So you can have just offered a community nurse to give him the injectables at home, and she can even look at him. Yani she can give him the injection and she can examine the site of injection every time if you are concerned about this. Okay, he needed this answer. And for his cat, as you said, there is animal service, there is social workers. You will help him with that. Okay. And when he told you, I have some concern, I don't want to stop my drugs, instead of just saying, first, you just let the talking flows. You can ask him directly, can you tell me more about this? What you are concerned about? Then he will explain to you. Then, okay, I can see your concern, but let me explain to you more about this. Okay, just like it's flowing, it's a normal conversation.
Okay.
Okay, you are keeping the information, but just try to soften it a bit. عشان ما تبانيش ان انت stressed. I know it's stressful, but try to be more relaxed when you are talking. Okay.
Okay.
دكتور صلاح طبعا العيان he is blind, you have to announce yourself at you are present. Just tap a little tap on his shoulder. You are showing respect to him. I am here, I have arrived, and I will start talking to you.
Okay.
Thank you, but very well. Okay, just keep training and you will get much better.
Thank you, Dr. Mrcs. Thank you.
You're welcome. Dr. Salah.
Okay. District nurses, they are working in district nurse can be coming to your home and giving you the injection if you are refusing to go for the hospital or staying in the hospital. They are working in this world. Anything you want a nurse to accompany patient or to follow him at home, you can tell district nurse, and it's accepted by this way. Okay, for TKR, we will not do it, just reading it. TKR came once, 2019 in UK, once, and nobody told me anything about this station except we have counseling for TKR. So we collected many questions. From NHS and shared in the book. No need to do this station, just read it. If will come. Okay, I think we finished by this way. Most of them, they are doing great. Still only the communication part, body language.
هي just simple بس tips زي ما دكتور صلاح. Just get relaxed كده, change your tone of voice. You are talking to a human being. He is not an actor. Just you are dealing with a patient. Listen to him carefully with empathy. Change your tone of voice. Mirror the patient. So he's concerned. You seem to be listening to him carefully. Okay, what are you saying? Okay, just like this. Don't appear to be just reading from a paper. Okay, and you will do great, I'm sure. If you just be natural. Except those orthopedics يا دكتور صلاح, دول مش عايزينهم يبقوا ناتشرال.
ما بيحسوش. البنت عماله تعيط قدامه
دكاتره العظام بس لا مثلوا.
ماشي عادي. عماله تعيط قدامك وده هيفال بتعيط ده يا عم. لا ده انا اللي المستشفى والله.
لا والكارثه اللي بيقول لهم كده واحد جراحه
Okay. Tomorrow it's Coach Murad. I am ready anytime tomorrow. I know very important MOOC tomorrow. Very, very important you to attend. This is a MOOC you are preparing phone call, so it is a must for you to attend. So according to your time.
I will try, Dr. Salah. المشكلة I have a course. I will do my best actually but Okay, no problem. I will try to be present even لو أنا حتى راجع مثلا هبقى أحاول إن أنا موجود على طول. Okay.
إن شاء الله.
Okay. Thank you guys. Thank you Dr. Salah. See you tomorrow إن شاء الله.
بكرة في هاندس اون. هاندس اون tomorrow.
Yeah, I think it's tomorrow. لا after tomorrow.
even if you have hands on, this will be recorded. It's a very important book, by the way. We want to finish from it. ماشي. يلا يا
Okay.
شباب.
Thank you guys. مع السلامة.